First, I'm going to start with your biceps, your patella, and your Achilles. Perfect. Now, I would like you to clench your teeth, move your jaw side to side, and I'm going to check for cranial light reflex. Look straight ahead. Thank you. Now I want you to close your eyes tight. Move your eyebrows upwards, frown, and smile. Perfect. Now I want you to open up your mouth, stick out your tongue, and say ah. Perfect. Now I want you to run your heels down your shin. Perfect. I want you to put your finger to your nose. Perfect. I want you to walk across the room. Walk back on your heels. Walk back on your toes. Walk back on your heels and toes. Perfect. Now I want you to walk with rapid alternating movements. Perfect. Thank you. Now you can have a seat. Now we're going to do your sensory. So now I'm going to run an object down your arms and your legs. You're going to tell me if it's sharp or dull. And close your eyes, please. I'm going to start with your left arm.
Soft, soft, hard, hard, soft, soft, hard, hard.
Perfect. Now I want you to stand up. Close your eyes. Stick your hands out. Perfect. Now I want you to have a seat. Close your eyes. Stick out your palms. I'm going to write something on your palm. You're going to tell me what it is.
The number 8.
Sure.
The letter A.
Perfect. Now I'm going to place an object in your hand. You're going to keep your eyes closed. And you're going to tell me what the object is.
Paperclip.
Perfect. And the other hand?
Coin.
Perfect. Now you can open your eyes. I'm going to inspect your skin. We're going to start with your arms and your legs. I'm also going to palpate the skin as well. Perfect. Now I'm going to inspect and palpate your fingernails and your toenails. And I'm also going to check for capillary refill. Okay. Perfect. And these toes as well. Perfect. Now I'm going to inspect your head. Do you have any lumps or bumps?
No.
Perfect. Now I'm going to inspect your neck. Perfect. I'm going to auscultate and palpate your temporal and carotid. Palpate first. Okay, now I'm going to palpate your frontal and maxillary sinuses. I'm going to palpate your TMJ as you open and close your mouth. Perfect. Now I'm going to palpate your lymph nodes. We're going to start with the preocular, postocular, tonsillar, submandibular, submental, interior cervical, posterior cervical, superior clavicular, inferior clavicular, occipital, and axilla. Now I'm going to palpate your thyroid from behind. Swallow. Perfect. Now I'm going to inspect your eyes. I'm going to palpate your upper lids and your lower lids. Perfect. Now I'm going to test for extraocular movement. I want you to keep your head straight and you're going to follow my pen light. Now I'm going to check your pupillary reflex. Just look straight ahead at the wall. Perfect. Now I'm going to test for accommodation. I'm going to put this towards your nose. Just look at it and follow it again. Perfect. Now I want you to cover your left eye. And when you see the light in your periphery, please say yes when you see it.
Yes. 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 Yes.
Now cover the other eye. Same thing.
Yes. 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 Yes.
Perfect. Now I'm going to inspect your ears. Any pain or discharge from your ears?
No.
No. Perfect. Now I'm going to say 3 words. I'm going to whisper them. You got to repeat them back.
Book, crayon, pencil.
Perfect. Other one.
Bed, door, cat.
Perfect. Now I'm going to inspect your nose. Okay. I want you to cover one nostril, breathe in and out. Same with the other side. Perfect. I'm going to inspect your nares. Perfect. I want you to close your eyes. I'm going to pass something under your nose. You tell me what it smells like.
A marker.
Perfect. Now I'm going to inspect the inside of your mouth. Stick out your tongue. Move your tongue up, down, left, and right. Perfect. Now for the gag reflex, I would use a tongue depressor. And I would have you stick out your tongue. And I would place it in the back of your throat until you have the gag reflex. Okay. Now I am going to check for jugular vein distension. Perfect. Now I'm going to auscultate your heart sounds, starting with the diaphragm, aortic, pulmonic, herbs, tricuspid, mitral. I'm going to do the same thing with the Bella telescope. Aortic, pulmonic, herbs, tricuspid, mitral. Perfect. Now I'm going to auscultate your arteries. Aorta, renal, femoral. Perfect. Now I'm gonna check your respiratory system. So I'm gonna start with assessing for fremitus. I'm gonna put my hands in this motion on your chest, and you're gonna say 99 every time I do that. Okay? I'm gonna do the front and the back.
99, 99, 99, 99, 99.
I'm also gonna do the same thing in the back.
99, 99, 99, 99, 99, 99.
Perfect. Now I'm gonna listen to your lung sounds in the front and in the back. And when I do that, when I place the stethoscope, you're gonna say 99.
99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
I'm also gonna do the same thing in the back.
99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
Perfect. Now I'm gonna percuss the lung sounds as well. I'm gonna do the same in the back. Perfect. Now I will check your oxygen level with a pulse oximeter. I will place it on your finger, and that will give me your pulse and your oxygen level. But we don't have that right now. Okay. Now we're gonna check your musculoskeletal. So for that, I'm gonna have you lay in the bed. First, I'm gonna inspect your shoulders and your elbows. in your wrists, in your fingers. And turn to the side. I'm going to inspect your spine. Perfect. Your hips. Okay. Your knees, your ankles, and your toes. Now, I'm going to have you sit up. Okay. I want you to push your head forwards, backwards, side to side, ear to shoulder, ear to shoulder. Now I want you to press against my hand. Perfect. Press backwards. Perfect. Side. Perfect. Other side. Perfect. Now for your hands, I want you to put your hands all the way up. Put your hands all the way down. Perfect. And I want you to extend your hands all the way up. Perfect. And I'm going to put some weight on your shoulders and shrug upwards. Perfect. Now, to check for your spine, I need you to stand up.
Okay. So we're going to say that cranial nerve 2, your optic nerve is intact, okay? First, I'm going to have you take a look at this pen light here. I'm going to do what's called the 6 cardinal fields of gaze. I'm just going to have you follow my pen with your eyes, okay? Just the eyes. Wonderful, you did a great job. And that means that your cranial nerves 3, 4, and 6, your ocular motor, your trochlear, and your abducens are all intact. Next, I'm going to have you do, I'm going to check perla in your eyes. I'm going to just take a quick look. Nice. Really, really good. So next we're going to that and that. And I'm going to have you, again, look at my pen light. I'm going to put my finger behind my head. Don't even bother, okay? And now look at the finger. Beautiful. So you have accommodation, you have direct and consensual pupillary response, which means that your perla is intact. That's exactly what we like to see. I'm going to have you go like this with your hands. Flip them over a couple of times. Put your hands up. Count your fingers. Fast as you can. Beautiful. And now again, I'm going to take that same pen light. I'm going to hold it here. Touch your nose. Touch the pen. Touch your nose. Touch the pen. Touch your nose. Touch the pen. Beautiful. So those 3 tests, your cerebellar function is intact as well. Now I'm going to have you, let me get my handy dandy tools over here. I'm going to start with, I'm going to have you close your eyes. Tell me where I'm touching.
Forehead, left cheek, right cheek, chin.
Wonderful. And I'm going to have you smile at me, be mad at me, be sad with me. Wonderful. Cranial nerve 7, your facial nerve is intact. Now I'm going to have you open up your mouth, and I'm going to just take a quick look. Stick your tongue out all the way. Beautiful. That's cranial nerve 12, hypoglossal, which is intact, moist mucous membranes. And I'm going to take this. Let me put my little piece of paper to the side. Let me figure myself out, right? Now I'm going to put the tongue depressor down, and I'm going to have you say, ah, okay?
Okay.
Ah. Beautiful. So like I said, everything is pink and moist as we want it to be, and your ability to say ah, open up your mouth like that, are cranial nerves 9 and 10, which are your glossopharyngeal and your vagus nerves, okay? Next, I'm going to palpate your sinuses, okay? Any sensitivity, pain when I'm doing this?
No.
Nope. And I'm going to have you clench your jaw. That is cranial nerve 5, your trochlear. Beautiful. Now, also while I'm here, I'm just going to feel your scalp. You tell me, do you have any pain or tenderness?
Nope.
Nope. And I'm just going to make my way down to feel your lymph nodes, assess those. This is your occipital lymph node. I don't feel anything that I shouldn't there. This is your post-auricular, your pre-auricular, your submandibular, your submental. Now I'm going to creep my way down your cervical chain. Wonderful. Into your subclavicular. Nice. And while I'm here, I'm also just going to palpate your thyroid. I don't feel anything, any abnormalities, no goiters, anything like that. Everything feels good. I don't notice anything with your lymphs. They're very palpable. I don't notice any hard irritation, anything like that. Also, while I'm here, I forgot, I'm going to check your nasal passages as well, okay? And if you look up, I'm going to give you a quick little piggy nose. Wonderful. Moist pink, as they should be. I'm going to inspect your ears. Got a little freckle right here. That's normal for you?
Yep.
Okay. Beautiful. And I'm just going to shift down from the face, and I'm going to come over here. I'm going to kind of feel, muscle tone feels even. Just going to assess your skin really quick here. I don't notice anything. You got a little scar right here. You've had that?
Yeah.
Okay. Sports or something like that?
Yep.
Okay. Again, we're going to look here. Again, you got just like a little mark down here. That's the only thing I noticed. You're aware of that? It's like a birthmark.
Yep.
Had that your whole life, pretty much.
Yes.
Okay. Next, I'm gonna have you squeeze my fingers. Wonderful. And now I'm gonna have you put your hands like this. Resist me, resist me, resist me, resist me, resist me. Go like that. Resist and resist. Awesome. And while I'm here, we're gonna check for clubbing. I don't see any clubbing in your fingers. I'm gonna check for cap refill. Less than 3 means you're perfusing well. That 98% O2 stat could have told me that too, though, right? Next, we're going to move on to the respiratory part of this assessment, your lung assessment. I'm going to make my way around. I'm going to untie you back here, and when we do this assessment, so first I'm going to percuss over your 6 lung spaces, 6 on each side, so it's going to be 12 in total. After I do that, I am going to listen to the same 6 lung sounds. I'm gonna have you take a deep breath every time. Please let me know if you need a break, because I know taking 12 big deep breaths can be kind of hard. And before we do that, I'm gonna have you shrug your shoulders up, resist me, and shrug, shrug, shrug. Wonderful. That is cranial nerve 11, your spinal accessory. First, I'm going to percuss. These first couple spots I'm gonna percuss have your scapula over them, so they're gonna sound dull, but we should hear resonance throughout if everything is a-okay, all right? Dull. Dull, 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 still a little dull. Yeah, big scapulas. Now we're hearing that resonance that we want to hear. And final one. Beautiful. So I was hearing resonance where I needed to hear it, dull where I should have heard it. That's beautiful. So far, things are sounding good. Next, I'm going to do the actual listening portion. Like I said, just let me know if you need a break. It's a lot to take those 12 deep breaths, okay? Okay. First deep breath. Second deep breath. Next. 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 And final. Wonderful. I don't hear any wheezing, any crackling, which is a good sign. Your lung sounds are clear. I'm going to have you take one more big deep breath. And I noticed when I was doing your assessment and doing that now that you are symmetrical on both sides when you take a deep breath. Just going to assess your AP to traverse ratio, which is 2 to 1. That's perfect. That's what we want to see. I'm just going to have you close you up like that. Next portion of this assessment, we're going to begin our cardiovascular exam, okay? Move our blanket to the side. I'll have you come on over. I'm going to have you come down this way. We're going to lay down, put our head on that pillow, okay? Beautiful. Comfortable?
Mm-hmm.
I'm going to cover up your legs. Just keep you warm, keep your privacy, okay? So first I'm going to remove this pillow from under your head, okay? Have you put your head down. Maybe turn your head to the side. No jugular vein distension. Other side. Again, no jugular vein distension. I'm going to put this pillow back under your head. Keep you comfortable, right? There you go. And I'm just going to feel your carotid. And right here. Wonderful. Those are symmetrical, bounding at 3. That's normal. That's what we want to feel. And now I'm just going to listen for bruise, which is a sign of an aneurysm. It's a whooshing sound that it normally makes. We don't want to hear that, okay? I'm going to listen with my bell activated. And on this side. Beautiful. I don't hear any bruise, which is good. Now I'm gonna pull this down. We'll begin that cardiac assessment. And you're comfortable like that? That's okay?
Yeah.
All right. So for this cardiac assessment, there are 5 spots that I'm going to listen to on your chest, and then over here when I get to your tricuspid valve, this is the apex of your heart, or the top of your heart, and I'm going to listen here for a minute to listen to your apical pulse, okay?
Okay.
So beginning with my diaphragm activated, I'm going to start here. This is your clavicle. Going to count down 1 intercostal space and 2 intercostal spaces. This is where I'm going to place the diaphragm of my stethoscope and listen to your aortic valve. And now I'm going to activate my bell. Listen in the same place. Wonderful. Now we're going to come basically the same way over. Again, clavicle, first intercostal, second intercostal. This is your pulmonic valve. I'm going to activate my diaphragm and listen here. Activating my bell. Nice. I'm going to activate my diaphragm again. We're going to come down to the base of your sternum, right around here, a little off to the left, and this is called Erb's Point. This is the next spot we'll be listening to. Activating my bell. Wonderful. Next, we're going to listen to your mitral valve, which is going to be 5 intercostal spaces down. I'm going to count 1, 2, 3rd, 4th, and this is your 5th intercostal space. We're going to activate our diaphragm. We're going to listen here. And we're going to activate our bell. Nice. And now we're going to come over here to that tricuspid valve, same 5th intercostal space coming right around here. We're going to listen right here. And now I'm going to activate that bell, and I'm going to put it back here, and I'm going to again listen for a minute for your apical pulse.
Fist for me. We're going to measure your MCP joint. Okay. Good, you can relax. Okay, now if you can do this with your fingers. Okay, you can relax. Okay, and now do that same motion again. If you could kind of bring that up to me. Okay, relax. Okay, now if you can put your palm up, and I'm going to ask you to bring each finger up to the ruler and then drag it down. Okay. 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 Okay, now we're going to measure the thumb. So if you can put your hand like this and bring your thumb out as far as you can. Okay. Now if you can put your palm down and make an L. Okay. And now make a fist and bend your thumb. Okay. And now bend this one as much as you can. Okay, relax. Okay, and now you're going to take each finger and try to touch it to your thumb. Okay. Okay. Great job. And now we're going to start manual muscle testing of the wrist. We're going to start with the flexors. So if you can bring your palm up and bring it towards your body and then turn it towards your pinky. Good. Hold it there. Don't let me move you. Good. And now you're going to bring it towards your thumb. Good. Hold it there. Don't let me move you. Good. Relax. Okay, now we're going to do the extensors. So palm down. Bring your hand up and turn it towards your pinky. Good. Hold it there. Don't let me move you. Good. And now turn it towards your thumb. Hold it there. Don't let me move you. Good. And with your palm down, you're going to lean into it and then bring it up towards your thumb. Good. Hold it there. Don't let me move you. Okay, now we're going to do manual muscle testing of the wrist with gravity eliminated. So if you could put your arm on your side, bring it forward. Good. Hold it there, don't let me move you. And hold it there, don't let me move you. Okay, now with it still on the side, bring it back. And same thing, hold it there, don't let me move you. Hold it there, don't let me move you. And hold it there, don't let me move you. Good job. And now we're going to do manual muscle testing of your fingers. So if you can start with your palm up. And bring your finger up. Hold it there, don't let me move you. And bring it up. Hold it there, don't let me move you. Bring it up. Hold it there, don't let me move you. And bring it up. Hold it there, don't let me move you. Okay. And now same thing, but bring that part up. Hold it there, don't let me move you. Bring it up. Hold it there, don't let me move you. And bring it up. Hold it there, don't let me move you. Bring it up. Hold it there, don't let me move you. Good. Okay, and now palm up. Bring all 4 of your fingers up. And then hold it there, don't let me move you. Hold it there, don't let me move you. Hold it there, don't let me move you. And hold it there, don't let me move you. Good, okay, relax. Okay, now we're going to do your extensors. So if you can make a claw and have it facing you. And then hold it there, don't let me move you. Hold it there, don't let me move you. Hold it there, don't let me move you. And hold it there, don't let me move you. Okay, now if you can make a longhorn, put your elbow on the table. Okay, hold it there, don't let me move you. And hold it there, don't let me move you. Now we're going to do your abductors and adductors. So if you could start with your palm down, bring your pointer finger out. Good. Hold it there. Don't let me move you. and your middle finger out. Hold it there, don't let me move you. Now bring it the other way. Hold it there, don't let me move you. And bring that one out. Good, hold it there, don't let me move you. Okay, and now elbow on the table, all your fingers together, and don't let me pull them apart. Good. Okay, now we're going to test the little finger. So palm up, bring your pinky up, hold it there, don't let me move you. And now bring your pinky and your thumb together. Hold it there, don't let me move you. And now palm down, bring your pinky out. And don't let me move you. Okay, now we're going to test your thumb. So if you can bend your thumb, hold it there, don't let me move you.